Okay, everyone. Well, it's 2:30 Eastern, so we can go ahead and get started. Welcome to the Housing and Services Resource Center's webinar, Accelerating Housing and Services Partnerships to Advance Housing Stability. And today we're going to focus on Area Agencies on Aging, or AAAs. This is the second webinar in our Accelerator webinar series, and we're honored that all of you have chosen to join us today. Next slide, please. My name is Ryan Elsa, and I'm the Interagency Housing Innovation and Strategy Lead at the Administration for Community Living, and I'll be your facilitator. Next slide. First, we just wanted to go over a couple housekeeping rules that relate to the Zoom feature images on the slide. For audio, please use your computer speakers or dial in using the phone number in your registration email. Please note that all participants are muted. We hope that you'll actively use the chat throughout the webinar to make comments or connect with other participants. To ask a question, though, we ask that you use the Q&A section within the Zoom function, and this will allow the presenters to easily find your question. Please note that this event is being recorded, and by staying you're agreeing to participate in the recording. And next slide. Now, a few accessibility tips. We will have ASL interpreters pinned throughout the webinar. To enlarge the view of the interpreter, you can click on their view on their window and select the pin icon to maximize your view. For screen readers, if you'd like to reduce unwanted chatter, you can request speech on demand by hitting the insert spacebar and the letter S on your keyboard. Next slide. So first, we wanted to get started by doing a quick little poll to learn a little bit about who's in the audience today. And in the chat, could you please tell us what your primary sector is? For example, are you with a Medicaid agency, health or healthcare, housing or homelessness organization, disability and or aging, human or social services, community development, association, advocacy, philanthropic, education or research organization, consumer organization, or another? So please just drop that in the chat. And next slide. And in case some of you are not familiar with the Housing Services Resource Center, the HSRC was launched by the U.S. Departments of Health and Human Services and Housing and Urban Development in 2021. And the HSRC fosters cross-sector partnerships between organizations and systems that provide housing, resources, and homelessness services, healthcare and mental health services, independent living services, and other supportive services. And the Housing and Services Partnership Accelerator is one of the HSRC's signature initiatives. Next slide. The goal of the HSPA, or Accelerator, is to support states and communities to accelerate the development and implementation of innovative state strategies through Medicaid demonstrations to provide housing-related services and supports to persons with disabilities and or older adults who are at risk of or experiencing homelessness. As shown in the U.S. map, 8 states and D.C. were selected through a competitive process to participate in the year-long accelerator. This includes Washington State, and you'll soon hear from an area agency on aging in Washington that has a Medicaid contract to provide housing or supportive housing services. Next slide, please. The Accelerator federal partners and the participating states know that the coordination of housing assistance with wraparound and supportive services is a proven cost-effective approach to assisting older adults and people with disabilities and individuals with chronic and complex health conditions to transition from homelessness, exit or avoid institutional settings, and live in the community. This illustration provides a high-level sense of how housing, health, and social care partnerships can support an older adult or person with a disability with exiting homelessness. To orient you, so you can look at it more closely after the webinar, the top arrows show the Medicaid and health, housing, and social care funding streams that can be braided together. To have the most impact, the supports funded by these streams are deliberately coordinated so that as people journey from homelessness to housing stability, they get a seamless set of supports. At the bottom, the lines are dashed because the mix of supportive services should be responsive to the individual's preferences and needs, and the mix of assistance would change as the individual situation changes. Today, you're going to hear one way that this model can be implemented at the local level. And we feature an area agency on aging that gets its core funding from social care from the Federal Older Americans Act. This AAA became a contracted provider for a Medicaid-funded supportive housing services program, and they created a partnership with a public housing agency to bring in the rental assistance. The AAA then brings together these housing, health, and social care resources to assist individuals reach their goals. And next slide, please. To give you a quick overview of our agenda, we'll next learn about an area Agency on Aging, or AAA, as a vital partner in helping people with housing stability and other social drivers of health. Then we're most fortunate to hear from a Washingtonian with experience in that state's supportive housing services program and the AAA that provides them with assistance under the state's Medicaid demonstration. Next, you'll hear more about how the AAA and the local public housing agency coordinate on the rental assistance component. And towards the end, we set aside time to address your questions that you can ask using the Zoom Q&A feature. And next slide. And our presenters today in order of appearance include Molly French, Director of Housing Services at US Aging, Lynn Kimball, Executive Director, Aging and Long-Term Care of Eastern Washington, Spokane, Washington, Rob Johnson, a Spokane resident, Amanda Siebert, Spokane HA Manager at the Spokane Housing Authority. And with that, let's hear from Molly.
Thank you so, excuse me, thank you so much. About US Aging, we are the National Association of Area Agencies on Aging, and we also provide a voice in the nation's capital for the Title VI Native American Aging programs. Many of you are here today because housing instability and homelessness are priorities for you, and they are for us too. In fact, 85% of area agencies on aging, or AAAs, have told us that housing and homelessness are major concerns in their communities. Next slide. So what is an area agency on aging? AAAs are the federally designated local leaders that help ensure that older adults can age optimally with optimal health, well-being, and independence in homes and in the communities. AAAs maintain a bird's eye view of the provision and access to home and community-based services in the community, and then they develop programs and services that help older adults live stably and well in the community. I'm going to go through various slides. They'll have different facts. I'm just going to hit a few. After I present, I'll put in the chat some links where you can actually pull the additional information, and we'll have the slides. We'll notify everyone when the slides are available. Next slide. In US Aging's 2022 survey of AAAs, we learned that 81%, or 4 out of 5 AAAs, offer at least one housing-related service or support. And so as you can see in this table, this ranges from things from home modifications to housing navigation, eviction prevention, services in shelters, and a lot of other types of assistance. So in other words, AAAs are already valuable partners in the community. They specialize in serving older adults, as well as also serve people with disabilities of all ages, helping them secure and maintain housing, and then also making sure that home and community-based services are available so that they can live stably and well. Next slide. Here on the left chart, it just gives you some context that 42% of AAAs are nonprofits and 31% are part of local government. On the right, you'll see 2 pie charts, and they show that in 2021, 47% of AAAs, or about half of AAAs, were contracting with healthcare entities. And that number has risen steadily over the past decade. And you may think, why? Well, that growth in healthcare contracting is a great indicator that AAAs are longstanding, trusted community resources. They're experts at providing programs and care that address social needs affecting health. And these include housing, transportation, nutritious food, and social support, to name a few. Next slide. I'm next going to delve into just a few facts from US Aging's 2023 survey of community-based organizations about healthcare contracting. And that healthcare contracting spans and includes Medicaid managed care plans are the top source of those contracts. There are also hospital and health systems, VA centers, and other health plans and providers that are doing this contracting with AAAs and other community-based organizations or CBOs. So they're turning to CBOs for those health-related social needs in order to achieve better health outcomes for the population. Next slide. These circle charts show that between 2017 and 2023, just as there was growth for just the AAAs who with healthcare contracts, among the CBOs, including aging and disability networks, they have also seen a growth in their healthcare contracting. And again, this growth is happening because of their ability to deliver results to health plans, health systems, and other providers. Next slide. Here we see with this bar chart that care management and assessment screening for social determinants of health, including affordable housing, and also assessment screening for long-term services and supports are the top 3 services in CBO's healthcare contracts. Next slide. And in this bar chart, 14%, we learned that 14% of healthcare contracts with AAAs and other CBOs are specifically for individuals at risk of or experiencing homelessness. Further, these healthcare contracts also entail serving populations that tend to be priorities for Medicaid managed care plans and also other health plans, including higher risk or populations that are at risk for nursing home placement, emergency department, also hospital readmission. Other populations covered in these contracts include people with chronic illness and with behavioral health needs. Next slide. From our CBO survey and listening a lot to our AAA members, we know that increasingly they are AAAs and other CBOs are forming community care hubs. And these hubs help streamline contracting for healthcare providers and partners and plans, as well expand the geographic reach. It also, the healthcare of the community care hubs also are a boon to CBOs because the hubs provide the administrative structure that you need for healthcare contracting. So it provides a great on-ramp for CBOs. Community care hubs are thus just an additional way for health plans, managed care, also for Medicaid, to connect with the aging and disability networks, including AAAs. Next slide. So how do you find your AAA? AAAs are in every community across the US. And when I finish up, I'll put into the chat the link for the ALTCEW locator so that you can find your local AAA. You can use the QR code, and I'll drop in more links after I'm done to access US aging resources on housing with housing data and some of our homelessness case studies. And we also have great resources through the US Aging and Disability Business Institute. And now I'm really excited to dive into how one AAA Medicaid funded contract is making a difference in Eastern Washington with our guests, Lynn Kimball and Rob Johnson. I'll turn it over to you, Lynn and Rob.
All right. Well, thank you so much, Molly. We really appreciate being able to be here. So I'm here with Rob today, and we're just here to talk a little bit about your experience and kind of what led you to us and what it was like. So just to start us off, can you tell us a little bit about yourself? You had told me you used to be a preventative maintenance mechanic.
I was, and shortly thereafter, I was in a car accident.
Yeah.
That changed everything. I've worked professionally as a millwright, a fabricator, and at a professional level. I was injured in a car accident, a head-on collision, and that triggered a whole raft of stuff, you know. I didn't realize, I used to live in a 5-bedroom house. I drove an Audi. Now I do not. Yeah, yeah.
Yeah. So that crash kind of changed the trajectory of your life.
Yeah, in a blink of an eye, everything changed. And after several years, you know, I went through life savings and ended up not having a place to live.
Right.
So, you know, my car and a tree house, that's pretty much what I had.
Right. Right.
And now I don't know.
Yeah. So when you started experiencing homelessness, what were some of the barriers you faced as you were trying to get into housing and try to figure out how to navigate things? What kind of things did you come up against?
I think the biggest thing I come up against was having to do stuff online.
Right.
You know, if you don't have a computer, that's the one obstacle, even to get there. But I guess in my age, I have been left behind. Technically, I don't know how to navigate the internet.
Right.
I don't know why. I don't know how. I mean, I can watch YouTube maybe, but as far as finding stuff to fill out,
Yeah.
was a big problem for me.
Right.
The fact that people are inherently superficial.
Yeah.
And so, you know, if you go to a job interview smelling like homelessness, and there is a smell to it, people are turned off by it, and
Yeah. Yeah. So it makes it that much harder. I can definitely see that if you're not able to use a computer and a lot of assistance is online and trying to work through that.
almost everything is.
Yeah. Yeah.
Uh,
So when I know you work a lot with Rose. Rose is our one of our supportive housing coordinators. How did she help you find a place to live?
that is that I can't remember.
That's okay. How about where were you when Rose first got a hold of you?
I was staying next to the river, and I had built a landing in a tree that turned into a tree house. But it was the middle of winter and it was pretty damn cold.
Yeah, yeah. I remember she told me that she got a hold of you on the phone, but then she had trouble reaching you. And
Yeah.
she was really worried.
Yeah, you know, there were times I can't afford a phone or
Yeah.
a phone number, I guess. Yeah, it became an obstacle. And another issue is trust.
Right.
That was something else that I don't know who people are. You know,
Yeah.
why are you calling me?
Yeah. Yeah.
And today is, you know, the amount of information that's done over the web.
Right.
You don't know what's real and what's not anymore.
Yeah.
Well, I don't, I guess.
Yeah.
Uh,
Yeah, it makes it really hard to, getting phone calls and you don't know the phone number and who is it and
yeah,
is this legitimate?
yeah. You know, Rose was a constant in this in this trip I made. You know, she, for lack of a better way to put it, she was a Sherpa through this mountain of paperwork that I, you know, with a memory issue, I did not have all the information
Right.
all the time, and
Yeah.
people would ask things and I'd get halfway through something and then frustration sets in.
Makes
And
it really hard to navigate. Yeah.
You know, I've got other things to worry about, finding food, finding a house, you know, someplace to stay, how I'm gonna stay warm that night.
Yeah.
There's a lot of things other than filling out paperwork that come to be
Right.
more important at the time.
Yeah,
because your time becomes, right now, you know,
Yeah.
it's not.
yeah. You're not looking at weeks or months ahead. You're looking at
Right.
what am I doing right now to stay safe?
Yeah.
And yeah,
Yeah,
yeah. So once she got you into housing, how has she continued to work with you?
uh, she's a constant, I was able to call her when problems came up. And whether it was her duty or not, or what she did, she did not pass the buck.
Yeah,
And I think that's the biggest thing. Um, she even found a place
yeah,
that would accept somebody like me.
yeah. No, that makes a difference. Yeah,
It does, because believe it or not, people are superficial.
yeah, yeah,
And if you go up, you know, say you haven't been able to shower for 2 weeks or a week or whatever it is,
yeah,
yeah, people they don't want to rent to you,
right.
period.
Yeah,
You know, we all like to pretend that it's not there, but it is.
it is. So having somebody being able to do some of that back and forth with landlords and get things set up
Absolutely.
makes a huge
I
difference.
believe that's
Yeah.
very accurate.
So I know we've got a lot of people here today from all across the US. What kind of things would you want people who are attending today to know about helping older adults that are unhoused?
That we don't have the technical background to navigate.
So having everything online applications can be a big barrier,
I
isn't it?
believe that's probably the biggest barrier.
Yeah,
Yeah, you can't always go to a library and work on the internet, because you're too worried about where you're gonna sleep tonight.
right, right.
Travel is another issue, being able to get places. That's was pretty hard.
Yeah. Well, I really appreciate you coming and sharing your story with us today. And yeah, it's been awesome getting to know you just the last couple weeks. And we're going to go ahead and transition to the next part of our presentation and into our slides. So thank you so much, Rob.
Thank you for inviting me.
Thank you. All right. Well, thank you everyone for joining us today. So like you heard earlier, my name is Lynn Kimball and I'm Executive Director for Aging and Long-Term Care of Eastern Washington. We're the local area agency on aging for our little corner of Eastern Washington State. Next slide, please. And so you can see here, really our goal as an area agency on aging is to help older adults, people with disabilities, and caregivers live their best lives at home. So we've got a nice diverse service area going all the way up to the Canadian border, all the way down into the Palouse. But a lot of our housing services really focus in on our most urban county, it's Spokane. Next slide, please. So to share a little bit about our housing journey, we really started well before the first 1115 waiver in Washington State. We had started to see more and more people we were working with. We do case management for people who receive Medicaid and home care services. And we were finding that more and more people we were serving were ending up unhoused. And we would kind of tap into different resources to get them rehoused. And there was no kind of supports to help people ongoing. So a lot of people we were serving, we were seeing this revolving door of you'd get somebody housed, there'd be an eviction, and then you'd be right back into crisis mode and trying to get somebody housed. So we really wanted to make sure that we had something to really try to specialize. So we started with just kind of the incremental step of we had a case manager and a care coordinator that had background in housing and they were really passionate about it. So we started with, okay, we're going to let them specialize a little bit with their caseloads to work on housing. And when the waiver came around and foundational community supports came around, we said, we really want to participate because it takes a lot of dedicated time and energy. It's hard to add on to the list of everything else you need to do in social services as a caseworker. You really do have to have some dedicated time and expertise to spend with people. And our community, like others, is seeing a really rise in the number of people who are experiencing homelessness in our older adult population. So Spokane County, where we are, 2017 to 2022 saw a 171% increase in those age 65 and older that are experiencing homelessness. And so it's one of those, it's across the nation. I know it really is what helped bring us to where, we need to actually start some programs and start some services to serve people. Because really as the Area Agency on Aging, we're here to respond to the needs of our community, and it was definitely a need of our community. Next slide, please. So we started participating in foundational community support. So this is a part of Washington State's 1115 waiver. There's two parts of it. There's supported housing and supported employment. And we said, we're going to become a supportive housing provider. So the state works through a third-party administrator who contracts with community-based organizations like ours. These services are really targeted to Medicaid beneficiaries that are 18 and older who have complex health needs. So they have to have some kind of medical necessity for the service. So it could be mental health, substance use, need for activities of daily living and assistance, or complex health needs that really make it so that they need some additional help. And then there's some specific risk factors that really come into play for eligibility. Next slide, please. So you can see here, there's a lot of different risk factors that can come into play. And when we first started, we really started with just working with those individuals we're serving through case management who are getting Medicaid in-home care. And those people we were care coordinating through our health home program, part of our state's duals integration program. And we often found that a lot of the people we were serving through these programs that were experiencing housing crises met at least one, if not more, of these risk factors. And the last one there, PRISM, is an actual risk tool our state uses with claims data. So they can look at people's healthcare spend. And if people have a high spend, their risk score actually goes up. So based on that spend and their chronic conditions, it really tells us, okay, this person is really probably somebody who needs some extra help and assistance. Next slide, please. So supportive housing itself is a provider. It lets us work with people across the journey. So we tend to think of housing services as something you do just to get somebody into housing, but it really takes a lot more work than that. So as you heard about working the paperwork Sherpa of Rose, there's a lot of paperwork to get somebody housed, especially into affordable housing, getting them set up with vouchers, navigating all of the applications and assistance, and then coordinating. Because oftentimes, especially in Medicaid, you might be working across with their case manager if there's things they can authorize through Medicaid to help and provide that assistance as well. And then working through any kind of barriers that might be holding somebody back from getting right into housing to begin with. Next slide, please. And you can see here that once you get somebody housed, the beautiful thing about it is we're able to support that person longer term. And that's really is what brought us to this service to begin with. It's not just to help people get into housing, but then to be able to continue to help and support them. So a lot of times that's working with landlords, could be working with neighbors. So We work with a pretty wide variety of different populations. And so sometimes it's okay, there's a dispute going on. Let's kind of help make sure there's a plan in place, help to do some of that medication. So hopefully we can help prevent eviction from happening to begin with. And then really kind of do some of those supportive pieces because, once you're in housing, especially if you've got assistance with that housing, there's paperwork that keeps going. So sometimes you also have to provide continuous supports so somebody can stay safe and stay housed. Next slide, please. So we worked with a lot of different partners with this. So we really started with the supportive housing program through foundational community supports. And then during the pandemic, we actually added on with our community living connections, our helpline, we added on 2 counselors that really started to help us work with our pre-Medicaid population as well. And kind of during that process, we've grown our team. So we have 4 staff members that work in foundational community support, supportive housing, and then 2 options counselors that work with our pre-Medicaid population as well to really work to get people housed. And through growing those programs, we started working with Spokane Housing Authority because we found, we need access to Section 8 vouchers. And we had been working through some waiting lists and it wasn't the most efficient system. So we worked to partner together so we can get a dedicated voucher per month. So 1 per month may not seem like a lot, but we use every single one and we always work to get that person ready to go in housing, using it each month. We also have developed a lot of partnerships with local landlords and different housing providers so we can kind of hear of openings as they're coming. We work with homeless service providers in our region as well, oftentimes to try to connect people, locate people, get people the right resources, keep people safe until they can get housed, and trying to do that coordination. One last piece is we had access for foundational community supports to a funding source called Transition Assistance Program that helped as well, because that helped with move-in costs, with relocation costs, deposits, all of those things, those kind of expenses that most people don't have money saved up. That really can be barriers to getting someone housed. And we also established our own client emergency fund so that we can help do some of those things like pay for background checks, application fees, moving expenses, deposits, where if people don't have the resources to do it, we can help kick in a little bit to really make sure that that transition happens. All right. So I am going to go ahead and transition us over to Ryan.
Thanks so much, Lynn. And thank you, Rob and Lynn, for presenting. And I know Rob's probably not looking at the chat, but there is a lot of gratitude that was expressed from our audience today and hearing from his journey. So thank you so much for sharing that. And I think it really helped ground today's conversation. Now, let's bring in Amanda to join Lynn in talking with me about the partnership before we open up to the broader Q&A segment. So with that, Amanda, can you start off by telling us a little bit about the Spokane Housing Authority?
Absolutely. Well, the Spokane Housing Authority has been in business in our community for well over 50 years, and we provide subsidized housing to the 6 counties that are largest on our side of the state: Spokane, Pend Oreille, Ferry, Stevens, Lincoln, and Whitman. So there's quite a bit of overlap with the counties that Lynn discussed earlier. And in those counties, we serve over 6,000 households providing affordable housing. So we run the gamut and the interventions that we offer at Spokane Housing Authority. We have several hundred project-based housing units that we help to subsidize. We also do permanent supportive housing that has more supportive services right on site for residents. And then we offer, Spokane Housing Authority offers housing choice vouchers. You may hear them called Section 8 vouchers or just vouchers in your community. Additionally, statewide, we administer the Bridge program, or some of you may have heard it GOSH program, the Governor's Opportunity for Supportive Housing. In that program, we also help to house over 560 households who are exiting or diverting from some of those long-term care solutions that Lynn discussed earlier.
Thank you very much. And Lynn, can you tell us a little bit about how your partnership with the Spokane Housing Authority started?
Yeah, so our Community Living Connections director comes from the housing community. She runs the Homeless Connect every year. She's chaired that for many, many years. And she brought with her, coming to our agency, a lot of connections. And she was seeing how much we were struggling with getting Section 8 vouchers. And so she approached the Housing Authority and said, hey, can we get one dedicated? We can use it. Let me show you how we have everything set up so we can make sure that that voucher gets used every single month.
And can you both tell me a little bit about how your organizations work together?
You bet. So we love working with the organization and with the AAA in our area. One of the things that we do, as Lynn mentioned, is we offer that housing voucher that they're able to send for folks just like Rob, who they're working with that need the stability of long-term housing. But additionally, they're able to help us in so many other ways. So because of the FCS program and the other services that they offer, they're really able to provide services that a housing authority typically does not offer for participants, stabilization services, and helping them to get through the process. And I think that we work great together. We're newer into our partnership. I think we're in our second year, and there's been huge success. It's been a fantastic partnership. And seeing the impact that we're able to make and how it's so much greater when we work together than it would be if we worked individually on this has been phenomenal.
Right. Yeah, the Housing Authority has been such an amazing support. And it's been one the more we learn, the more we figure out, okay, here are some new pieces that we need to add to our services to help make sure that we can kind of expedite getting people into housing, that they keep their vouchers, and and tapping into so many other resources that are out there.
Thank you both. And can you share a little bit more about how the people that you serve benefit from this collaboration?
Well, it really makes a difference. None of us work in a vacuum. And when we look at housing and we look at aging services, we all have our own specialty, and it really takes a lot of coordination to make things happen well. Because oftentimes it really is put kind of in the lap of the person who needs services. And, as you heard, you're trying to just get through each day. You're just trying to survive. And it's hard to do all of that coordination yourself. So it really, really helps to have us partner together, because we can really make sure we're doing the pieces on our end to try to reduce the stress on the person, and that we can get them into housing and keep them stably housed.
Absolutely, I would second that. We heard Rob speak today about some of the things that were barriers for him: his memory, his computer skills, transportation, trust. And housing is such a small piece. It's a huge part of someone's life, and it's a huge need. But we can't just plop people into a home and say, there you go, you're great. And so we need people that can help walk alongside the participants, help them with that paperwork, help them learn stabilization, the good skills they need to be great tenants, and to really make sure that they're in a home that they can sustain. And through our partnership, we're able to do that so much more so than an average community member would receive.
Thank you. And are there other benefits for your organization and the community at large that stem from this partnership?
Sure, absolutely. I think that it's so important in today's day and age, particularly in our area with the low housing stock and the barriers that people do face. It's so important that we're looking at creative solutions, and we're looking at creative partnerships. And this is not a partnership that you see pretty regularly nationwide or in many areas. And I think that as a result, in addition to the things that we talked about today, both agencies are able to elevate the services that they can provide. So if we have people that also come in that are community members not already associated with the AAA, we're also able to rely on them and to refer to them and assist partners and assist our participants in their needs, and additionally just utilization. We don't want to see units that are open or vouchers that are unused, and being able to make sure that we're providing these services to people that are able to use them, have the supports that they need to maintain them and really benefit in a holistic manner is a huge benefit to us and our community in large.
Yeah, I think another example would be even just the road to renting classes. It's one of those, it's something that helps give people the skills they need, help go through those things, helps make them a little bit more attractive to landlords. And through our partnership, we started doing those trainings. So to make sure our population could access it and we could make it readily available. So it really has helped to have that kind of partnership because you just leverage one another's expertise, and the more you learn, the more you're able to partner and then share with one another, because we do so many other services and programs as an area agency on aging. That kind of cross education and partnership just makes everything work that much better for people.
Thank you both. Well, that's it for my questions. Now we can transition to the questions from our participants today. And we have a lot of really great questions that folks have submitted. So the first question is actually for Rob. The participant wants to first thank Rob for sharing his story, but they want to know, did you get any help from local faith-based organizations or United Way to help you find resources in the community?
You know, I don't think I can answer that properly because of my memory issues, but I do know that my landlord is faith-based, and that's been huge with support. Yeah. And I know that they are, their company seems to be faith-based, and that is actually huge.
Yeah. Yeah, I know a lot of our housing partners have faith basis to them. So we work with a lot in that realm for sure.
Great. Thank you so much, Rob and Lynn. And the next question is for you, Lynn. How does your agency work with unhoused individuals with criminal backgrounds, prior evictions, challenging credit, and other housing barriers?
Wow, I almost want to ask the person who's in the corner over here what she does. But she does a lot of everything from, we have a lot of local providers, local lawyers here that do like Warrant Fest, helping us quash warrants, working through kind of those background check issues and working through credit issues. So that there's pieces we can do to restore credit. And she's pointing to Rob here. Is there anything you want to add on this one?
Yeah, the fact that I am a felon, it was a huge obstacle.
Yeah.
Yeah, indiscretions when I was younger.
Oh yeah.
I've since grown up, I hope.
Yeah, it's those kind of things that, you know, people don't think about aging and that you have different issues to work with, but we were all young ones and we all did things when we were young. And some people got, you know, got caught and they've got backgrounds. And so that's a lot of what we do is kind of, that's where those relationships with landlords really makes a difference. So as you build those relationships over time of like, okay, this person has this background, we know that, but they haven't been offending, they're not doing anything now, they really just need a place to live, and we're here to come in and help support to make sure that they can stay housed.
Thank you both, Rob and Lynn, for that answer. So what funds or programs do you tap for immediate and short-term housing while people are awaiting more permanent supports? Voucher, supportive housing, and et cetera, in terms of those types of permanent supports?
Yeah, so I know we work a lot with local shelters. I mean, there is only kind of a limited amount of resources in our community. If somebody is on Medicaid, sometimes we're able to access emergent kind of emergency funds to do like short-term motel stays, things like that, to get somebody in an intermediate if we've got a plan to get them permanently housed. But it really, really depends on, you know, what is that person's background? What do they qualify for? But we try to get really, really creative. We work a lot with local shelter providers to just do back and forth, and sometimes to see, okay, can we find them someplace temporarily, especially if they've got ADL needs and huge accessibility needs, because we know a typical shelter is not the place you want to be if you've got those kind of needs for assistance.
Thanks for highlighting that, Lynn. I think that's a really important point, that our shelter systems are really not set up for older adults and people with accessibility needs. So
they really aren't. Yeah, and it's one of those, and it's we so often see people, they've entered the shelter system and they end up victimized. So, and then they don't want to go back because, and it's understandable, it might be a, you know, roof over the head, but it's not a safe place. And so a lot of people have that experience of out and camping even in the middle of winter because it seems like the safer alternative.
The next question is, are most housing units available through private landlords?
We work with both private and public, so all of the above. There's often long waiting lists on public housing. So we try to get people on whatever waiting lists are possible. But in the meantime, we're always searching the private market to see if we can find something that's going to be affordable or who's willing to take a voucher.
And then I'm going to ask this both to you, Lynn and Amanda. What are outreach strategies that work better than electronic email connections for communicating with older adults about housing and resources? And would also invite Rob if he'd like to answer that as well.
Yeah, I would say go track people down. Sometimes you go to where people are, and that's the best way to reach them. And once you get that connection, if they know where you are, we try face-to-face as much as we can. And once we have phone numbers and we've connected, we just try to keep in touch.
Yeah, I think for me, it was having somebody that I could get a hold of whenever,
Yeah.
you know, for whatever.
Yeah.
Whether she was able to help or not, there's still comfort knowing that there's somebody there.
Yeah. It helps to have that resource person. And once you have that trusted relationship, it really makes a huge difference. Instead of, okay, now you need to go call this person or go call that person.
Yes, I would agree 100%. I, for many years before this, did homeless outreach. So I went out and was talking to the people like Rob when he had his tree house that he built. And I think that it's so important to go out, like Lynn said, meet people where they are. I know that a lot of AAAs may not do that, but if not, who are the resources in your community that can help you with outreach to get people in? And it's so important to just have the connection. I feel like so much in today's day and age, we rely on electronic connections and virtual connections, and that doesn't work for many people. And so that in-person connection, communication are huge.
Thank you. And then for non-voucher participants, how is the cost of the unit rent being paid?
Yeah, it is based on if we can get them into an actual subsidized apartment, then that's where we're usually trying that, or we are just watching. We are watching and looking for anything affordable to come up, which is always a challenge, but that's where those relationships with landlords that are willing to keep rents lower and not increase them really makes a difference, because they know that person's going to have that ongoing support.
Do you offer any incentives to landlords? And if so, what are they?
We don't. We have no incentives to landlords. I don't know if the housing authority does, but ours is the incentive is we're going to stay there and we're going to work with them.
We do offer incentives incentives to landlords. So we offer tenant-based incentives such as deposit and move-in costs, but we also offer incentives to new landlords, returning landlords, and for landlords that sign new leases and maintain our tenants in place. So there are a variety of different eligibility components, but we have found that to be very helpful in helping to get people housed and to mediate issues with landlords.
Thank you. And then we have a participant who used to work in fair housing and had some observation that sometimes housing providers aren't perfect in understanding disability and aging issues and aren't friendly to partnerships with entities who do this work. How are you successful in working with landlords? So we talked a little bit about some of the incentives, but like, do you have other kind of examples or best practices?
Lynn, do you want to start with that one on your end?
Yeah, it really is like helping people understand kind of what other supports we can put in place is sometimes, and then kind of communicating this is the person and this is their condition and these are the things that are going to happen. So in our world, especially, you know, if somebody has Medicaid and home care, so they've got accessibility needs, they need help with personal care, knowing that we aren't just housing this person, but this person is actually coming with a paid caregiver that's helping to provide supports, that they've got other resources that are helping, that are supporting that person long-term. So it helps them understand that like this isn't as risky as they think it is, that there really are other resources and supports that we can put in place to help people be successful.
Great, thank you. And Amanda, for you. So if I were to reach out to my PHA today and initiate this conversation on behalf of my AAA office, what initial planning and coordination steps should I consider before I broach this discussion?
Well, first, I would absolutely encourage you all to reach out to your PHAs to see what partnerships you can develop. If you don't reach out, you're not going to ever know, right? I think that some of the initial planning steps that you want to talk about is what are you going to do to support that relationship? So what are some of the things such as the things Lynn's agency has done to help support our partnership and the clients being successful? We talk about the landlord mediation, helping with paperwork. We require in our MOUs, our agreements with agencies, that they help with 6 months post move-in stabilization. So we're not just putting people in a unit and they're willing to contract to do that. And so I think a big thing would be to bring to the PHA how it's going to benefit you all, some of the things you've learned today, but also what can you bring to the partnership? What will you do that's going to elevate a participant's success over someone who's just going to come in off the street that they'll hand a voucher to? And I think that, you know, in many communities, they're having to look at housing as a crisis nationwide, right? So we're having to look at these more creative solutions and look at creative ideas for housing. And I think if you bring the ideas to your PHA and you bring some good planning on how you can be successful in that, you're going to have a good success.
Thank you. That was really helpful. So we have an audience participant who's in a state who doesn't currently have these types of housing related supports through their Medicaid authorities. So I'll ask Lynn and Amanda if you want to answer and jump in here. But can you talk a little bit about how you engaged with your state Medicaid agency? What opportunities were there to provide your voice, or what are ideas for people who are in states that don't currently have these types of supports in place? How can they really help be an advocate to bring these to their localities?
Right. Well, I know in our state, we've been really, really fortunate. I always say I am so blessed to be in Washington State because we work really well together. So we've worked for a long time as the Area Agency on Aging with our State Unit on Aging, which also works with our Medicaid authority. And so when they were designing the waiver, they actually came to area agencies on aging, and we had some dialogue about these are the things that are happening, these are the needs. And as an area agency on aging, if you have data, so if you are running information and assistance and you're getting calls from the community about housing, track your housing calls. What is the volume? How many people are you serving that are in housing crisis, and providing that back, providing examples of models like, permanent supportive housing where you can wrap things around a person, and how successful it's been in other states. And sometimes it always feels like you're the noisy person in the corner is the area agency on aging of any meeting that you can get into with any of them. It doesn't have to be, this is the sole purpose. It's showing up and saying aging and housing is an issue and there aren't enough resources and we need something in our state. And just, you just have to, sometimes you shout for a long time, but eventually people start hearing. And the more and more that other providers realize you're there and that you want to help as well, it really, really helps as you come together.
Absolutely. I would echo all of that. Don't stop being the one in the corner shouting. Keep coming to the table and keep talking about the issues. Legislative advocacy, talk about the issues to or at your representatives. Send those emails, send the data. But also, I think that you can start on a small scale too. What can you do to partner yourselves and help build greater data and build that momentum that you can bring forward and just keep moving, keep being the one, like I said, keep talking and keep that momentum up. And we are very lucky in Washington, but other states are following suit.
Great, thank you. And one quick last question before we transition to wrap up. Do you collaborate with your state's Money Follows the Person program? And if you're not familiar with MFP, the Money Follows the Person program demonstration and state Medicaid systems are the programs that help individuals transition from nursing homes or other institutional settings back to home in the community, because they can access the home and community-based supports there.
Yes, we do work with our Money Follows the Person. I know it has another name in our state. I think it's Roads to Community Living. And as an area agency on aging, we work with our state partners a lot that are working on transitions from facility to home. And we've also got other resources we're all able to tap into on the medical or on the Medicaid side for those transitions. So we're often all working in tandem. So sometimes it's someone we're working with ends up in a facility, and it's about bringing them safely back home. And then, like Amanda said, we also work with Governor's Opportunity for Supportive Housing and helping people transition from institutions as well.
Great. Well, thank you, Lynn, Rob, and Amanda so much. This has been such a rich and important conversation. So a virtual round of applause from everyone. And thank you for joining us today. If we could bring the slides back up, I just wanted to offer a few of the many takeaways that we heard today. To recap, Medicaid options now offer states and local community-based organizations with options to address housing as a health-related social need. Our Accelerator is helping 8 states and DC to implement their Medicaid demonstration or waiver with housing-related services and supports. And for older adults and people with disabilities, housing stability often entails a mix of not only housing and health, but also social care that is supportive services for other health-related social needs like nutrition, transportation, personal care, or housekeeping. As Lane showed us, AAAs and other aging network organizations can form multi-sectoral collaborations, including through Medicaid or other healthcare contracts, to support older adults and people with disabilities who are at risk of or experiencing homelessness. And next slide, please. We hope you're using the HSRC website, which has a wealth of resources on housing, health, and social care. On the homepage, you'll find a feature that will take you to the Accelerator site. Today's slides, the recording, and transcript will be posted online. Just use the QR code to navigate there. And next slide. The HSRC has a lot of features as depicted in the circle graphics here. Some of the most useful features of the HSRC website include the focus area sections, which has resource topics like affordable, accessible housing and care transitions. You can find housing and services partnership models and discover a variety of toolkits, data, and housing and health and social care directories. And our What's New page is a quick way to find upcoming webinars and more. And next slide. And as I mentioned at the start of the webinar, today is a part of an Accelerator webinar series. Be sure to register for our October 10th webinar, which will feature Centers for Independent Living. Staff will drop the link in the chat, and today's webinar and the first on the state successes will be posted soon. And next slide. We also ask that you help us improve our webinars in TA by completing a short feedback form, which you can access using the link in the chat or the QR code provided here. And next slide. And remember that the HSRC is your resource center. So sign up for the HSRC listserv, which is now 20,000 strong. Use the QR code or the link in the chat to receive notices about upcoming webinars, new resources or tools, and the latest updates. And also, please email us at hsrc@acl.hhs.gov about your cross-sector partnerships and technical assistance. And last but not least, we want to thank New Edition's US Aging and our ASL interpreters and CART special services for their role in the production of today's webinar. And we're grateful to everyone who joined us today. And thank you and have a great afternoon. Bye, everyone.